I'm Wolf Flitzer. You're in the Situation Room. And we're following the breaking news, escalating concern right now about Ebola in the United States.
Listen, this Ebola story, it is fast-moving. A lot of changes today.
The healthcare worker Amber Vinson was moved from Dallas to Emory University.
The flurry of Ebola news that seized our nation also gripped the healthcare leadership media, making continuous headlines in the weeks that followed as the story unfolded at one of our nation's leading hospitals. What was not so clear, which many healthcare insiders realized, is that Ebola exposed the lack of preparedness and attention to HAIs, healthcare-associated infections, a silent killer of 75,000 Americans from the 700,000 infections that we give patients every single year. When the Dallas caregivers contracted Ebola, it became a healthcare-associated infection, along with the big 6 infections: surgical sites, central line infections, ventilator-associated pneumonia, MRSA, Clostridium difficile, and urinary tract infections. This situation demands that we look outside of the walls of our hospitals for innovations that can save lives. A recent survey of leading quality and safety leaders revealed a major lack of Ebola preparedness, and many are asking for help, especially in the areas of cleaning innovations and disinfection.
The emergency department's ground zero for hospital-acquired infections. I mean, this is a very dangerous situation, not only for our patients, which 1 in 25 of patients in the United States are actually going to contract a hospital-acquired infection, but also to our caregivers as well.
Whether you serve at one of the more than 130 academic medical centers or a frontline clinic, caregivers are going to have to advise families beyond their own walls. Infection prevention is not just an academic public health issue, it's a real-world, urgent community safety issue. Our traveling and dining population needs information about infection prevention. The Ebola crisis was also a wake-up call to the airline industry. Norovirus is not just a cruise ship and restaurant issue. The cruise ship industry was almost capsized by a tidal wave of fear from the many outbreaks of norovirus which appeared unsolvable. The virus can spread quickly through small contained spaces and unsanitary environments through food, water, and contaminated surfaces, a setup for cruise ships, very much like nursing homes and hospitals. The outbreaks were tackled by an end-to-end systems approach with CDC scientists, and the cruise ship companies searched for innovations from other industries. The old mantra of better, faster, cheaper, you can have 2 of the 3 is false when it comes to disruptive innovation. For instance, the use of delivery systems that spray small droplets, slightly polarized with electrostatic energy, has allowed the cruise industry to sanitize entire cruise ships with fewer chemicals, better coverage, and faster than ever before, contributing to a dramatic drop in cruise ship infections and helping to revitalize the industry. This was just a direct substitution of an innovative delivery system with revolutionary impact. It's just this kind of innovation that we need in healthcare. Caregivers are performing without a safety net. It's time to patch the gaps of leadership practices and technologies. This means we need to take an end-to-end systems approach to all infections, especially the ones we give patients. We need to chart the path patients take through our emergency rooms to ICU to treatment floors. We need to identify the hazard zones where we can fail to disinfect and keep our environments safe. The BioPlanet system is a breakthrough innovation that the cruise ship industry borrowed from other industries, with revolutionary results. This better, faster, and cheaper innovation is the kind we need to look for to tackle HAIs. As with the cruise, airline, and restaurant industries, there are hazard zones such as high-contact surfaces that can be decontaminated much easier with polarized droplets that provide uniform coverage of even hard-to-reach surfaces. Unique to healthcare and Ebola is the enormous challenge of personal protective equipment, the don and doff difficulties, and the handling of the enormous volume of contaminated materials. In a side-by-side simulation of conventional spraying of chemicals on PPE versus that of polarized droplets of the very same chemical EPA-registered fluids, the coverage is no contest. So as you design protocols for Ebola and HAIs, you must critically evaluate the best technology innovations that can serve you. This one is a direct substitution, an elegant delivery system with the same chemicals that has better coverage, is faster, and is cheaper in staff time. So healthcare leaders from the top, with trustees and CEOs, through the mid-level management to the front line, have been warned and need to own the issue of infections and build the safety net that caregivers need and patients deserve. Ebola was our canary in the mine. We had our early warning. We can make it safe. However, we don't have time to waste. Act now.